we're very excited about our latest offering, our Wheelhouse Center of Excellence and Wheelhouse AI Center of Excellence. And you couldn't be coming at a better time. One of the things we're seeing as we travel around and we talk to global healthcare leaders really around the world is that they're identifying this need to get out in front of governance and regulations, et cetera, and tackling that at the same time, trying to figure out what implementation might look like and where to start their modern AI journey, if you will. So Wheelhouse started actually as an effort. We were working with a major medical system, actually many hospitals in the United States. And we essentially what we did is we met with the chief information security officer, some other executives, every other week for about a year. And the mission of those working sections was to help this healthcare organization, again, get out in front of AI. So, what could they do to protect themselves from a legal perspective, from a compliance perspective, from a governance perspective? Where should they start focusing their attention, et cetera? And so essentially what we did is we encapsulated that work at the end of the year, and then we turned that into our Wheelhouse AI Center of Excellence. And because it was based on real world experience and helping this large healthcare system, do exactly that, get out in front of AI, it's a proven success story. And then what's interesting about Wheelhouse is, as an engineer myself, personally, of multiple decades now, I don't want to age myself, I firmly believe in we use the term eating your own dog food. And so one of the things that we did when we put together our Center of Excellence, Wheelhouse Center of Excellence, is we actually built it as a co-pilot. And so, the same technology, this modern AI technology that we're governing and deploying, we actually use it as the interface for information on governance, planning, et cetera. We've lumped it all in there. And then actually what's quite fascinating is we've actually found that it's a great way for hospitals to use it as a jumping off point and start to implement other solutions. So for example, a lot of folks are very interested in educating providers about social determinants of health and health equity and what that might look like and the importance in the data sets. And that's stuff that we can just easily add into the Wheelhouse AI Center of Excellence, if you will. And then another thing that we did, I think that really sort of put it over the top, is we actually published a book. We were one of the first to publish a book on prompt engineering, specifically tailored towards healthcare executives that are running hospitals. So we talk about things like finance and social determinants of health, provider services, et cetera. And so what we were able to do is we worked with multiple doctors and wrote this book. But then what was really powerful is we used those questions to train the model to be specifically great at answering those questions focused around healthcare administration operations. For example, what are you may ask our co-pilot, what are some tips for running a hospital system during high inflation? What can we do to maximize or optimize processes, right, in high inflation? So that's Wheelhouse. We're very proud of it. Again, it covers a lot. We've put everything that you need to get out in front of governance, planning, et cetera, training. But then it's also a great jumping off point to use our fine-tuned model just to provide just general guidance across finance, across HR, across planning, et cetera. So yeah, it's a wonderful gift, if you will, and I encourage you to check it out. Thank you.